Hey y'all. So it's Dr. O getting ready for the next Health Caring Differently episode with Dr. Latif Murji, who's a doc and a musician and like all of the things. So just about to add him. All right. But yeah, thanks for tuning in, y'all. So we're going to have a really fun evening with Dr. Murji. There we go. Ooh, hello.
What's up? What's up?
So good to have you. Thank you. We did it. You're logged in. We're live.
Yeah.
And folks are joining. So welcome, welcome. We are grateful to those of you joining. Got Jermaine and Solana, and I need new contact lenses, Kiana.
Zaniac.
Deb
Zaniac's
has
here.
joined, right? Kandal, Shaq, welcome, welcome. So why don't I do like full proper intro and welcome you properly, Dr. Murji. So yes, for all who don't know, actually, I should introduce myself. So I'm Dr. O, and I am the host of Health Caring Differently, where I am interviewing my friends and colleagues across the country who are leaders in healthcare, who are physicians in healthcare. We're different, and we approach health caring differently. So we do these every Tuesday, IG Lives at 7 p.m. Eastern Time. Please do join our newsletter. The first one went out this month where I talk about communities of support. So all kinds of diversity resources for people in scholarship, research opportunities. That's what we'll be having for you. But I want to introduce my guest today. So Dr. Latif Murji is a physician, musician, and health equity innovator. He exemplifies a rare fusion of medicine, artistry, and advocacy. As a faculty member at the University of Toronto, he's developed a novel health equity curriculum for Scarborough Health Network residents, and he founded Stand Up for Health. Big up to Stand Up for Health, massive, because there's lots of people involved with that, which is a not-for-profit organization. And clinically, he works as an emergency doctor and family doctor in remote Indigenous communities. He is the frontman of Parachute Thieves, so his band, where his music echoes his cultural roots and experiences, and he's a lover of poetry. Welcome, Dr. Murji.
So thank you, thank you. It's a long bio,
I shortened
but
it,
so
but I
yeah,
have
thank
to add a
you.
little spice, a little some, just
Uh,
spice it
I
up a
love the
little.
spice. Thank you. So yeah, what's up?
Yeah, no.
Where
So
where shall
I
we
mean,
go?
folks don't know. I was telling a friend earlier today how like this is what it's like to like get old. Like God willing, you will all get old. So you'll go through my
Thank you.
experience of like, yes, I got through medicine and then I became faculty and then I became a mentor for Latif like 5 seconds after I became faculty.
Yeah,
So it was at Taibu Community Health Center. Big up Taibu.
Taiwu.
And now he's like big man. He's an emergency doc family doctor professor, even though he was my mentee before starting
I
medical
still
school.
I
So
still am. You're still my mentor. So
you know
yeah,
what? It's true. It's true.
yeah,
Because Dr. Carl, who I did my podcast, Race, Health, and Happiness with, he's still my mentor.
yeah.
Like I've been following him around since I was in high school. So I think, I mean, I know so much about what you do. I don't know everything, but I know so much. But I want
Mm.
our listeners, our participants, to know a little bit about your journey. So, do you want to talk about a little bit of your identity? Like, how are you different, and how is that helping you to healthcare differently?
Oh man, so big.
Yeah, take it
All
wherever
right,
you
let's
want.
okay. Okay, so I'm gonna like try to keep this concise and then you can kind of take it where you want. So I'm different because I think from our perspective, we know that in medicine, like in med school at least, not everyone was different. Like we were the different ones.
Hmm.
So, just our like our background, where we're coming from. Like I came from Scarborough. my mom's from Uganda as a refugee, my dad's from Tanzania. So already I'm bringing a different perspective in the sense that growing up in Scarborough, I kind of experienced a lot of different things. Like my parents weren't doctors. So
Yeah, same
I
here. And
kind
you've
of,
got that African vibes, right?
yeah,
Like
exactly. Yeah,
the African connection. But yes, our parents weren't doctors, which is yeah,
exactly.
less common in
Yeah.
than in other spaces. Yeah.
So then coming into medicine, it's like a bit of a different culture that we bring in. And then thinking about like where to go when you're in medicine is a question that I was always asking myself, and even you helped me with that. But I think I noticed that I had this like generalist mentality. Like even before medicine, I was always drawn towards the arts, which, as you can see, like like fully diving in 100,000%
Yes, you're
in the
getting
past
little
few
hearts for
years.
that. I see some little hearts
Yeah.
coming up.
So
Yeah.
yeah, so like these kinds of things brought me like I brought into medicine, and then now I'm coming out of medicine and kind of I'm going to use this word a lot today, I think, like cross-pollinating
Mm.
ideas and bringing in that this generalist lens, and that's also why I'm in family medicine, because even though you introduced me as an emergency medicine physician, my training is in family medicine. This is like a unique thing that we get to do in Canada.
Yes.
Um, so I don't know if this answers your question, but this is like the first answer to whatever you're gonna, where you're taking this.
No, we're gonna take it wherever you want to take it, but I want to like highlight a couple of things because like we both grew up in like low income communities and
Mhm,
neighborhoods and then entered medicine, which is, even if people's parents aren't doctors, a lot of people are like more high income.
mhm.
And then you came in also with that kind of like advocacy lens, right? You bring
Yeah.
that into medicine and you also bring that creativity or arts or thinking outside of the box. Like, was that important to you to do like actually I mean yes I was mentoring you like pre-med and some of med but I don't know if you brought that into spaces or felt comfortable bringing that into all spaces during your
Mhm.
training or sometimes did you feel like you couldn't really talk about the fact that you were interested in like advocacy and health equity and like the work that you did with stand up for health like social determinants of health like were you bold
Yeah,
about it or a little bit timid at
I think
first?
I was pretty bold about it, to be honest. Like,
Okay.
and I think I was lucky because I was at U of T and I was at St. Mike's, which is like the Fitzgerald Academy, and
Mm.
that's where they like explicitly support this type of thinking. So I guess I got lucky to be in that type of community where the health equity lens is one of the default lenses that's used. And a lot of my peers were very supportive, and they were down to join me in the movement that we were kind of starting and continuing. So yeah, I think advocacy, it's even, thinking back, it's now like kind of a long time ago, but in my med school application, that was one of the things that I felt like, because Stand Up for Health, I started it, actually, I started it after I got into med school, the summer in between,
Oh, it was a summer in
before I
between. But
started.
tell folks about Stand Up for Health because that's
Sure.
cool that you had a project in the summer in between when you had started medical school, and then now it's your not for profit as a like
Yeah.
fully practicing doctor. That's rare.
Yeah, so like the year that I was applying to med school was my third year of undergrad, and I took a course called Social Determinants of Health, and it like blew my mind because it connected the theory of social inequities with my lived experience growing up in Scarborough,
Hmm.
and I noticed like around me, not everyone was connecting to that the same way. So I started thinking, first of all, we need everyone to understand this because we're all going to be future clinicians and how can we make that connection? So I started to think, why don't we create some sort of simulation experience using lived experiences that I had as well as my community members to
Right.
bring people into that world. So then that summer, I was at Taibu actually. This was the summer before I met you, and we
Hmm.
started doing it with the youth in Malvern in Scarborough. And then the next year was when you joined and we like were a research team and we did it with med students and nursing students, and it
Right.
kind of grew from there. Yeah.
Yeah. No. 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 I mean, it was cool because I think like I said, I don't know if there were times that you were timid, but you were always like authentic about the fact that you're about like, basically like social justice issues in medicine, social
Mhm.
determinants of health, the social factors that impact health, like poverty, racism, like,
Yeah.
education, all of those. And so, yeah, people would be like, oh, there's this, like at Tech, they're like, you got to help Latif, like Latif,
Yeah.
go and help Latif. But even when I was faculty, again, at the Faculty of Medicine, I would hear like, yeah, there's this young guy and wants to change the world. And
Yeah.
and I'm like, yep, I know him. We're on it. We're good.
Yeah.
And I encourage that for folks. I think sometimes people are scared to bring that authenticity of
Mhm.
their lived experience. And I mean, sometimes there can be bad experiences, but I think overall it's worth it to like bring that energy. I don't know what has
You
been your experience.
know,
Have you gotten pushback sometimes, or people being even later on in your career? Like,
honestly,
did you have challenges
maybe,
around that?
okay, maybe this is a chance for me to recognize you. Like honestly, like because I found people like you early that were supportive, then maybe like I was like blind to the haters. Like I don't even remember. Like I think there probably were, but they're just irrelevant. Like
Oh, I love
who
it.
cares? Because like we're on a mission. We're trying to do, like, we know it's the right thing to do. We know that people are gravitating towards this. We feel this movement,
Yes.
and we see the change. Like, look at the med school and U of T now. Like, look at what you've helped do with like the Black students application program. Like, there's that kind of change is so inspiring and uplifting that it doesn't not like things can't really slow us down, right? So
Oh, I love
and then I
it.
think,
I love it.
yeah, but so what I'm saying is I think maybe it has to do with having mentorship and having a community that you find early on, and then
Hmm.
you can really move forward.
Yeah, no, I think mentorship is so huge, and that's what we're trying to see what we can do. Like, again, like shout outs to Ike Okafor. I give Ike shout
Yeah,
outs all the time. In
yeah,
the newsletter that came out this week, we talk about communities of support. I think when it comes to mentorship, that's, how they say it takes a village to raise a child. I think it takes a village to support somebody becoming, like a full physician or health professional. And so being part of programs like diversity programs can help you find those mentors who believe in diversity, who believe in change, and can provide that support. Like in your case, for us, it kind of randomly happened, which is awesome, but
yeah.
it's not always going to randomly happen. I think being part of a program can really help as far as finding mentorship is key in healthcare, honestly,
Agreed.
particularly
Yeah.
medicine.
Yes.
So, okay, so you work as a family doctor. So I actually said emergency doctor and family doctor. I said both, right?
Yeah.
Do you want to talk a little bit about the work that you do and why you chose to go? Because you're in more remote Indigenous communities.
Hmm.
So yeah, why did you choose to do that, and what does that look like?
Yeah. Um, honestly, it was a last minute kind of change in my life plan, from when I was in residency. I was always, in med school and residency, I was always thinking that I would work in inner city healthcare.
Hmm.
That's so I continued to train at St. Mike's for both med school and residency, where they specialize in that and care of the homeless, for example.
Yeah.
And so I gained a lot of great experiences working in that context. But then I had this elective that was 2 months in Squamish, which is a rural part of BC in between Vancouver and Whistler. And it was so cool getting to do family medicine, emergency medicine, hospitalist. Like, you just get to do everything.
Yeah.
And it's just so independent and flexible and freeing that I was like, yo, we're gonna do this. Like, this is a thing we can do. And it also is fun because what I kind of set up was myself and some of my closest friends would go up in like buddy like pairs, and we'd go up to communities like Moose Factory or
Hmm.
Englehart or in Manitoulin Island, and we would live together and we'd take turns cooking, and then we would do the shifts, and kind of together we'd be running the hospital or the wards in the emergency department doing clinics. So and then the thing is that in a lot of these communities, these are primarily Indigenous communities where you still are getting to work with marginalized populations and have that
Exactly.
impact that we're
Yeah.
originally looking for. And in many ways, the need is much greater there
Hmm.
than in the even in inner city in some circumstances. So this is like, at least in this phase of my life, it allowed me to, or I was able to do that, and these experiences also really sharpen your skills. So it was a win-win.
Oh, that's like Really awesome. When I had Dion Sinclair, so she's a nurse VP
Mhm.
at CAMH, and she had worked like in Thunder Bay for several years, and then I was talking about how I had worked up north for a few
Yeah,
years, just in Long Lac, a small town. It's a francophone town, but also serves Indigenous communities, just like 3 hours northeast of Thunder Bay. But I think like those experiences are so important, like with kids and everything, I wasn't able to keep that up, but I think those were, it's even just like fishing with community members, like just
yeah,
learning like
exactly.
different ways of being the town doctor with some of my patients looking in my grocery cart. They're like, "Oh, so you're eating ice cream, Dr. Nora?" I'm like, "Well, I'm not diabetic, sir."
Yeah,
You can't have that ice cream. But it's like really cool to be in a totally different environment than our usual urban environments. And I think it's important work to do. So I think it's really cool that you do that. But speaking of cool, and let's like deviate from like standard work, you
yeah.
also have that balance of bringing in that creativity. I mean, you bring creativity into medicine, but then you
Mhm.
also have a life like outside of medicine where you get to express creativity. So again, you could take it wherever we go because there's like the band, there's poetry, there's ways you've gotten creative within medicine. You take that how you like it, run with it.
All right, I'll start with music. So I have a band, Parachute Thieves. This is a musical project that I've been at with my one of my good friends, Rob, for since we were in undergrad and we first met, and we had written all these songs, and then I got into med school, as I mentioned, and
Right?
doing stand up for health and all this other cool stuff. So it
Mm-hmm.
took a little bit of our energy away from music because training is pretty intense. Right?
Yes.
Just it's the truth.
Yeah.
Um, but the whole time I was a med student and a resident, literally every day I would be thinking, I'm like, what one day I need to do this. Like I was dreaming of the day that I would get to perform my original music in front of a crowd and feel that energy.
That's
And that day
amazing.
has come.
Yay!
So now I'm an old man who can do the things that I actually want to do. Um, and so, yeah, so then, a few years ago, we actually were like, we're doing this, we're taking this seriously, we're gonna get our music professionally recorded. It was just me and him, and we had written parts for bass and drums, but we
Right.
found like professional bass players and drummers, and we have an actual four-person band now, and we play shows. Actually, maybe I can announce
Yeah.
some good
Plug.
news.
Plug away.
We just got accepted to North by Northeast Music Festival
Wow.
in Toronto for June. So that we'll be having a pretty sweet show coming up. And yeah, and then we hope to
Congratulations.
thank you. And then we hope to have yeah, a bunch more shows this summer and possibly release an album that we have waiting. Just need to figure out exactly how to release it.
Well, I mean, you're already on Spotify, so like, let me just so yes, when that's about to come out, we're happy to put it on our socials to promote it, right? Because you're part of the Healthcare and Differently fam, but also like so your Instagram name here is Parachute Thieves, and then there's also we can folks can find you under that name or your band under that name on Spotify. So your music is already public. So I hope
Mhm.
people do check it out and then check you out at the festival. Do you know what day in June? Do you already know?
I think it's going to be the 12th,
Okay.
but just follow us and for more information. Yeah.
Nice. Okay, okay.
Yeah.
So we're at 7:18. I just want to flag if folks have
Oh, okay.
questions about
Mhm.
family medicine, emergency medicine, remote stuff, stand up for health, being an advocate, like all of those things are on the table and more, because we're gonna talk about poetry in a second. So all of those things are on the table, but please do ask questions. So bring your questions. We're going till 7:30, but I'm just letting you know please bring the questions. Okay, so Dr. Murji, yeah, so we're talking about art. I don't know if you wanted to talk about your work in poetry as well.
Sure. So, poetry is a beautiful thing. I think we can all agree on that. So I was just hanging out with one of my best friends, Addis, last summer,
Mm,
and we were like reflecting. We were like, what happened to the poetry on the TTC? And he found an article actually that in the Toronto Star from like 2012 or something that said that the program that put poetry on the TTC was discontinued, and everyone was sad about it. TTC was upset, and Pattison signage company, everyone was sad, and it's all because the person who created it had disappeared and was nowhere to be found.
Oh, wow.
Yeah,
Wait a minute. Okay. That's a lot right there. Okay. So,
yeah,
because first of all, because you said the article was from 2012. So that makes some sense to me because although I've been in Toronto since 2007, I didn't remember poetry on the subway because I'm not
yeah,
from here. I'm from Montreal. And then our viewers are likely younger. So growing up, I guess you always
yeah.
saw,
Mid
and where we say
2000s.
TTC, we mean the subway system because
Yeah,
we're
yeah,
national.
and
So
so
yeah,
yeah, so
go
we
ahead.
were on the buses, in Toronto and sometimes streetcars, but the whole
Ah,
public transportation system was coated with some beautiful poetry back when I was in
ah,
high school, and we
okay.
used to look at that and be inspired, and then it disappeared.
Because the
And
guy
then
disappeared.
because the
Is
guy,
is that person in like did the person pass away or
I
nobody
did not,
knows?
I
Oh,
he's
nobody
just nowhere to be
knows.
found.
Okay, okay. So
The
the person
Toronto Star
disappeared.
with their
Continue.
excellent investigative journalism could not track him down.
Damn, okay.
So I don't know.
Maybe he's in the witness protection program or something, but it is what it is. Okay, so poetry
He's
went
had living a
down,
great life somewhere.
hopefully.
But
Yes, but go ahead.
so then we were just like, yeah, why don't we just do it? And we felt like we had the skill set together. He's a Oxford MBA, so
Hey,
he's on the
okay.
ball.
Mm-hmm.
And I have, my diverse set of experiences, and we just went after it. And the TTC, so we asked the TTC, we asked Pattison, everyone was fully supportive. So they gave us this program essentially, and it was our responsibility to now make this a real thing. And I'll skip all the
The
boring
drama.
stuff. The point is that it happened. It exists now.
Mm-hmm.
It's called Poems and Passage. If you take the public transportation in Toronto and the TTC, you will see poetry up there, and
Yes.
hopefully your heart will feel it as well. And this is
Mm-hmm.
not just for this year. This is going to be an indefinite program where we're going to be elevating underrepresented artists' voices. We're going to be inspiring commuters. There's
Yes.
over 1 million rides that are taken on the TTC a day. So that's a lot of people that can possibly be inspired by poetry, and we're really proud of that.
Oh, and then you got to shout out Soliana saying that I see them all the time. Super cool. So folks are seeing them all the time. And I went to there was a poetry slam. So
Yeah.
along with the
Yeah.
TTC piece, right, that's on public
Hmm.
transport, there's actual events people can go to, right?
Yeah. So we figured, why don't we bring this to the community too? Like now that we've basically built this brand, we should use this for more good. So
Mm.
we created a poetry slam series, and we even tied it together with the TTC because we said whoever wins this series of slams will become a featured poet for next year's TTC. So it
Cool.
all tied it together, and then we had featured poets. And so to be young,
Yeah. Shout out
she
to
like
DeBee.
they're amazing. So we've had a lot of really great talent, and just bringing people out in the community was like a really cool thing to do.
I love that. And that's a way of bringing healing. And I think that's what's so beautiful. When we have an understanding of social determinants of health, which are like social factors that negatively
Mm,
impact health, but they can also positively impact health.
yeah,
And so, art in the environment, social connection, positive social gathering, expression of emotions in safe spaces, those are all forms of healing, right? You're kind of like you said, cross pollinating. In my work, I kind of think of us as part of an ecosystem of change within healthcare. And then, like you're cross pollinating outside of healthcare, but it's all
exactly.
part of that beautiful ecosystem for wellness and what's called salutogenesis, how health is created, right? As opposed to pathogenesis, which the other doctors are
Yeah,
really deeply focused on, how disease happens, but how does health happen? And I feel like the work you're
exactly.
doing is an example of salutogenesis.
Yeah, you're bringing up a great point. It's almost like um, we're pushing back against the inequities that hyper capitalism is creating by bringing people together, creating community, creating social cohesion
Yeah.
and positivity and art and healing.
Yeah, art and healing. That's it. I am okay, so we're at 7:24. Do folks have questions? about medicine, about music, poetry, art, about advocacy and pushing back. So this is like a last call for any questions or comments. People might have comments as well. Like we heard about the seeing the poetry on the subway all the time. But I just love the fact that, you know, you can have a vision for what you want to implement. And then sometimes it doesn't happen right away. Like you wanted to have a band, not a band, but not just a band. You
Mhm.
wanted to be able to like um, uh, um,
No, you're right.
provide
I wanted
music
to
in the
have, yeah,
world, right? Like to be a full
even
musician.
simply having a band, right? Like
Yeah.
we had me and Rob, and we weren't going to have a band of people who are like amazing at bass and drums, like until we prove to the world that we're capable of writing music that will attract other musicians.
Yes.
So even that was like something I was thinking about for years, and I knew that we needed to do that.
That's it. So you had it in your heart for years, right? And so for those of you like you're studying something, you have a hobby and you have to drop it. There have been lots of hobbies for me, dance or whatever, that I've had to drop, but I held it in my heart, kept that vision, and then was able to implement it. And we do the same thing within medicine, the creative things that we do. So, oh, we got a long question. Okay. So from Soliana Lijiam, so it says, as someone who loves visual arts and is an aspiring physician, hey, shout outs to you. I'm
Mm.
curious to know what other unique ways do you imagine art and medicine, intersecting in the future?
Yes.
There's so many ways. I don't
Yeah,
know. So go ahead, Latif.
there's
It's all yours.
okay. Sure. So I'll start with maybe some of the more like obvious things. So there's like art therapy and
Yes.
music therapy that exist as
Yes.
professions that are
Yes.
basically like in the clinical space. So that's something to look into. I won't describe the whole thing right now, but these are jobs.
Yeah. And
But then,
particular community health centers in marginalized
yeah,
communities, they're quite popular. Sorry, go ahead.
yeah, and even like on the wards in pediatrics, palliative
Mm-hmm.
care, there's probably a lot of applications for it. Um, and then in terms of, from my perspective, like I'm integrating it a lot outside of the clinical spaces. So um, as a physician, you can do anything you want, like, or literally anyone can do anything they want. But as a physician, particularly, you're like in this privileged space where you
Yes.
kind of can control like your practice, you can control your schedule, you can choose which specialty you go into, and then have a lot of autonomy. And then you can choose to build a not-for-profit if you want. You can choose to
Mm-hmm.
be an artist in whatever domain you want. So I, however you imagine it really is the answer because, what you think you said you're a visual artist. So, whatever medium you want to put your art on. Like for me, the first thing that comes to my mind is because I just did poems in passage is thinking of a public arts initiative that would be a visual art centered, which is possibly a direction we're actually going in with poems in passage. Is like pairing poetry with visual art or graffiti, some sort of accompaniment, and thinking about spaces that are beyond public transportation, like any public space would be
Mm-hmm.
enhanced with public art. And this can be thought of as a population or public health intervention to improve people's enjoyment of public spaces and bring people together, as opposed to advertising, let's say, which
Yes.
is just like distracting for people's attention and harming the public in a way.
Yeah, no, I think that's like a really beautiful example. I'm also thinking about, so one thing that I've been really reflecting on is Afrofuturism art. I
Mm,
love Afrofuturistic
yeah.
art. Um, but what's strange about it to me, and I also had looked up Afrofuturistic art. I wanted stuff for a clinic. So I wanted Afrofuturistic
Mm,
art that focused on like health. But for a lot of the paintings I was seeing, and people are using AI for the Afrofuturistic
mm,
art. So that's what I'm thinking. I mean, the AI and
yeah.
the Afrofuturism, it's often a single person. So it's like a cool one person who's got gadgets and like a
Uh,
head wrap or something that shows like health and Afrofuturism. But I would think the future still keeps, Afrofuturism is about keeping like pieces of the past.
mm,
So I'm like, how come there's no art of community?
exactly.
Because I feel like
Yeah.
even if we're, this idea that like the future means that we're all by ourselves, right? Like
Yeah,
you
we're a
always see that
collective.
in those pictures of the future. I feel like it should be still a gathering, right? So,
Exactly.
anyways, I think there's an opportunity to do a lot of creative things, bringing in, I'm using Afrofuturism as an example,
Mhm.
but even like Indigenous to white seeing or things where you bring aspects from the past, use AI, bring it into the future, do whatever. And I'm not creative in arts, so I'm going to stop there. But thinking about that
Yeah,
future piece of
but
the question.
that's so sick. Like that makes me think about like jam spaces, bringing people together, right?
Hmm.
It makes me think about like art battle, like where you
Oh,
literally have artists, visual artists, like at an event, like
yes.
just places that are you're gathering, that you're becoming a collective and you're producing art together. Um, I think that's the future, right?
Yeah.
Especially if we want to bring our values from our culture into these spaces, that's probably the way it could go.
I love it. Yeah, because real healing happens in community,
Mhm.
right? Of course, you have to go on your own for some of that, but it cannot happen fully in isolation. It happens in relationship. So
Exactly.
hopefully that answered your question. That was a cool question. I thought
Yeah,
that was fun.
that was a dope question.
I don't know if
Yeah.
there's any other questions or any other things you want to mention, Dr. Murji, before we wrap up.
Um,
He's laughing
I was
because I'm calling him
just
Dr.
yeah,
Murji
yeah,
because he's
yeah.
like my mentee. But yes, Dr. Murji.
No, no, that, that's I'm good. I'm good.
You're good.
Thank you.
Okay. And
Yeah.
so where can people go to find out about more of your projects or if there's even volunteering opportunities or like are there any cool opportunities people should know about on the clinical end
Mm.
and cool things happening on the creative end or in the space between?
Regarding my stuff,
Any, yeah, yeah,
um,
your projects. Like, is there stuff happening in Stand Up for Health or anything going
yeah,
on with you in general where people can be involved or know about jobs or volunteer opportunities? And then is there anything you plugged that you're going to be at the festival in June, but anywhere else people should be following you or your creative work as well?
yeah. Okay, so I would say if you want to get involved in any of these things, one of the things you could do is just reach out to me. So whether that's Instagram, I think on my Instagram I also have a link tree. Um, that's my Parachute Thieves link tree, but actually just you can also go on Linktree slash Dr. Latif, and then you'll see basically stuff about Parachute Thieves, but you'll also see Poems and Passage, where we actually have a link to join our team for Poems and Passage. You can see
Hmm.
stuff about Stand Up for Health there, and VaxFacts, which is a separate thing. But it'll all be there. But
Oh, okay.
you can just reach out to me, and I'm happy to help people out or provide opportunities that might be available.
Okay, so we'll send us the link to your link tree. I mean, it sounded pretty um, straightforward. It's Linktree and then Dr. Latif.
That's right.
Is that? Yeah,
Yeah.
but also just send that to us and we'll also put it in
Sure,
the
sure.
newsletter, listing the different things that people can find out about. Okay,
Cool.
so we've gotten some thank yous or thank you to both of us. So thanks, everyone. Thank you for tuning in. Next Tuesday, my guest will be Dr. Leah Jones, who's the Black Health Director from Dalhousie Medicine. So we're going to go way out east to find out what's going on, what's popping over there. But thank you so much, Dr. Murji, for joining us. And thanks everyone for tuning in.
Thanks, Ani. Bye,
Bye.
everyone.